Good evening and welcome to this meeting of the Republican Labour Trade Union Group. The topics being covered this evening are the Employment Rights Bill 2024, just been introduced by the Labour government on October the 10th, and the campaign to stop outsourcing of soft services by Ipswich and Colchester Hospitals Trust. And that part of the meeting will be led by Mike Hope. I am going to introduce the section on the Employment Rights Bill. And before I even start, I'd like to show you the first page of the actual bill that was presented on October 10th to Parliament. And I'd like to share my screen just to show you what it's like to read a bill. Here it is. Here's a bill. Here's the actual beginning of this Employment Rights Bill. Now, first of all, it says, be enacted by the King's most excellent majesty, by and with the advice and consent of the Lords spiritual and temporal and commons in this present Parliament assembled, and by the authority of the same as follows. So, I mean, that's enough to put you right off, isn't it, for a start? And then part one, employment rights. Zero
it's just flummery, really, isn't it?
It's just ridiculous. It's just ridiculous. But then this is the very first paragraph of of this part 2A, right to guaranteed hours. Part 2A of the Employment Rights Act 1996 is amended as follows. In the part heading at the end, insert and similar. So it means you've got to have the 1996 Employment Rights Act open at the right page, and then you've got to interpret what that actually means. So you can imagine how it goes on and how difficult it is to read an actual bill that's going through Parliament, and why MPs have to rely on what the government actually gives them, which is what I had to rely on, because I thought, well, I saw this and I thought, well, I'm giving up now. I can't possibly make head nor tail even of the first one, and I'm going to have to go and get the 1996 Act out to make any sense of it. So that's what our MPs are up against, which is quite shocking, isn't it? I'm just going to give a little introduction to the Employment Rights Bill. And my opinion of it is that it is handing to the Secretary of State a lot of powers, and they're going to be looking at secondary legislation again and again. So by the time this Employment Rights Act comes into being, into power, and is actually working, I think we're going to see a very different paper, a very different bill anyway. So I picked out a few bits of it just to talk about the 0 hours contracts bit. Okay. Now they're not doing away with 0 hours contracts at all. So this is how they're changing it. They're going to bring in the right to reasonable notice of shifts and payment for shifts that are cancelled or curtailed at short notice. The right to a guaranteed hours contract reflecting the hours regularly worked. Now that sounds all well and good, doesn't it? That sounds pretty good. So the workers on 0 hours or low hours contracts would gain a right to be offered a new contract or varied terms and conditions with a working pattern reflecting the hours actually worked during an initial reference period. And this could be repeated after subsequent reference periods. But, however, the Secretary of State would be given the power to make regulations setting out how this reference period must be calculated and the working pattern the employer would have to offer in such a situation. While not specified in the bill or explanatory notes, the government indicated in its next steps to make work pay policy paper that this would be a 12-week reference period. And this policy also stated we will consult on how these subsequent review periods should work with employers and trade unions, ensuring they are reasonable and proportionate for both workers and employers. And where shifts are cancelled, moved or curtailed at short notice, 0 hours workers would be entitled to a payment from the employer. But the definitions of moved, short notice, and what groups of workers would qualify and the level of any payment would all be set by the Secretary of State in future regulations. So it all goes back to the Secretary of State doing whatever they like, which of course is the Crown. Moving on to new protections against detriment and dismissal. Workers would gain new protections against detriment, including on the grounds that they declined to work shifts where the employer had not provided reasonable notice. For example, an employer must not stop offering the worker hours or reduce the worker's hours on the basis that the worker has refused to work such a shift as this would amount to a detriment. So, in other words, if you refuse to work a shift, you can't be refused other shifts. And another section would also create new protections against unfair dismissal in cases where employers sought to dismiss a worker in order to avoid their responsibility to offer guaranteed hours. But of course, none of this applies to agency workers as yet. So there's a big gaping hole in it. Flexible working. While the list of statutory reasons why employers can refuse a flexible working request would remain the same, including factors such as the burden of additional costs or detrimental impact on performance, a new and additional requirement would be added that it is reasonable for the employer to refuse the application on that ground or those grounds. In other words, the employer's got to say which grounds it's refusing to offer flexible working. So it's got to go into a bit more detail about why it refused it, but it's not really giving the worker any more rights, is it? Then we go on to statutory sick pay. Statutory sick pay, SSP, is the basic minimum statutory payment to which qualifying employees are entitled for periods where they're incapable for work because of illness. Listen to this, I didn't realise how low it was. It is currently paid at a rate of £116.75 a week. I don't know who can possibly live on that sort of money. So to qualify for this, an employee's average weekly earnings must be at or above the LEL, the lowest employment level, which is currently £123 per week. At present, the statutory sick pay is not paid for the first 3 qualifying days. These are called waiting days. So as such, that would typically be paid SSP from their 4th day of absence from work. So clauses 8 and 9 of this bill would remove the 3-day qualifying period, as well as the requirement to earn the lowest something level. What's it called? LEL. It's the lowest possible amount that you can earn to qualify. So the median weekly pay for full-time employees in April was £682, which means that the statutory sick pay of £116.75 was 17% of the full-time weekly wages. I mean, that is appalling, isn't it? Absolutely appalling. A 2020 OECD report found that among OECD countries, the UK's sick pay replaced the smallest percentage of full-time employees' wages in the first full week of leave due to COVID-19. UK SSP replaced about 10% of employee wages compared to an average of around 70% in the OECD. However, sick pay was topped up in the UK by non-mandatory employer sick pay, so the average full-time worker did have 100% of their wages replaced by sick pay in total. So the employers were doing that. At the same time, clause 9 of this bill would change the rate of SSP so that instead of all recipients being paid the flat rate, which is £116.75 a week, they would instead either receive the flat rate or a percentage of their weekly earnings, whichever is lower. But the percentage will be set and variable by, guess who? The Secretary of State. So in other words, the government can still decide what this percentage is going to be, and it can be varied as the Secretary of State likes. So the Crown has their claws into all of this. It's awful. Family related leave. This looks, looks a bit better. I didn't know this. Paternity and family leave, like bereavement leave for the death of a child, for instance, is paid at the flat rate of 184 pounds per week, or 90% of average weekly earnings. So having a baby is a lot better. It leaves you a lot better off than being sick, it seems. So moving on quickly to harassment at work. This also seems to be a bit of an improvement, because not only must the employer take all reasonable steps to prevent this happening, but it also must take all reasonable steps to prevent it happening due to a third party. So I think that is quite a good improvement in that particular area. Qualifying period for unfair dismissal. This is an interesting one. Clause 19 of the bill would remove the 2-year qualifying period that currently exists for the ordinary ability to claim unfair dismissal. However, there would be exceptions for employees who have not yet started work, which is fair enough, and for dismissals during an initial period of employment, referred to in some commentaries as a probationary period. So this would give the Secretary of State the power to make regulations altering the unfair dismissal test for employees dismissed during an initial period of employment, a probationary period. And the length this period would be determined through future regulations. So again, the Secretary of State is given the power to actually say how long this probationary period is going to be and what kind of regulations will apply to it. So in the next steps, the government's preference is 9 months. So basically what they've done is they've taken it down from 2 years to 9 months for you to have protection from unfair dismissal. In their next steps policy paper accompanying the bill, the government said reforms of unfair dismissal will take effect no sooner than autumn 2026. So we've got another 2 years to wait for this to come into practice. So it's quite interesting to know what the rights, the existing day one rights that provide protection for employees from unfair dismissal will not be affected by the statutory probation period. And these are making a flexible working request, being pregnant or on maternity leave, wanting to take family leave, for example, parental, paternity or adoption leave, being a trade union member or representative. These conditions tell you just exactly what employers have tried, don't they? They've tried to obviously get rid of people just being pregnant or on maternity leave. Taking part in legal official industrial action for 12 weeks or less, for example, going on strike. Asking for a legal right, for example, to be paid the national minimum wage. Doing jury service, I mean, should go without saying, shouldn't it? Being involved in whistleblowing. So I think that list of reasons why you definitely can't be dismissed for those reasons just shows you what's been tried in the past. Now, moving on quickly to fire and rehire. So 9% of people responding to a survey commissioned by the TUC in November 2020 said they had experienced fire and rehire. I think we all know the example from P&O Ferries. P&O Ferries made 786 of its seafarers redundant with immediate effect on the 17th of March 2022. So in response to that incident, the Department for Transport published the policy paper 9-point plan for seafarers in July 2022. And this plan included a provision to develop a statutory code of practice for fire and rehire practices, with potential uplift in compensation awarded in cases where the employer does not comply with the code. The code of practice was published and came into force on the 18th of July 2024. However, as noted in the code of practice, a failure to follow the code does not in itself make a person or organisation liable to legal proceedings. So there's no teeth to this at all. There's no legal proceedings. Rather, The code is admissible in evidence before courts or employment tribunals when claims are brought, such as for unfair dismissal. And a tribunal may grant an uplift of up to 25% of any compensation if it finds that the employer has unreasonably failed to comply with the code. Clause 22 of this bill creates a new type of automatically unfair dismissal. This would make it automatically unfair to dismiss an employee because either A, the employee did not agree to a variation of their contract, or B, the employer dismissed an employee in order to rehire them or hire someone else to carry out substantially the same job or on a varied contract. Such dismissals would not be automatically unfair. Here's it. If the employer can show that the variation of contract was because of financial difficulties that would affect its ability to carry on the business, and that it could not have reasonably avoided making the variation. So there it is. There's the get out clause for the employer. All they have to do is to prove those conditions are present. The employer would still need to show that the dismissal was fair, and section whatever it was provides a series of matters that must be considered in determining whether the dismissal was fair or unfair. One heck of a big let out clause, I think you would agree. Moving on quickly to public sector outsourcing. Clause 25 of this bill would create a power for the Minister of the Crown to make regulations specifying provisions to be included in a relevant public sector outsourcing contract that would guarantee that workers being transferred from the outsourcing were treated no less favourably than other workers of the supplier and vice versa. So this would prevent the emergence of what is referred to as a two-tier workforce of private and ex-public sector employees on different terms and conditions following the outsourcing of public sector work. But isn't it usually the case, this is just me looking at this, isn't it usually the case that outsourced employees are paid less than those employed by the state originally? So I'm not quite sure how that's really going to help matters at all. Gender pay gap reporting and contract workers. Clause 27 of the bill extends gender pay gap reporting requirements to cover outsourced service providers as well as direct employees of the reporting organisation. So that's a good change. And fine, if we come now to sectoral collective bargaining, I've just chosen, parts of this bill. Sectoral collective bargaining. Sectoral collective bargaining is where a whole sector of the workforce comes to an agreement with an employer or the government, mediated, of course, by trade unions, rather than just an agreement company by company. For instance, it could apply to the whole of the social care sector, the social care workers in the social care sector. And that's the sector that I'm going to concentrate on in the rest of this part of the talk. Now, sectoral collective bargaining was promoted and practiced in this country by governments of all political persuasions from the end of the First World War until the advent of Thatcherism in the 1980s. And as a result, by the end of the Second World War, no fewer than 86% of all workers were covered by a collective agreement, which was pretty good. So workers benefit, as a consequence, workers benefited from higher wages, better working conditions. Having also been commonplace throughout Europe, SCB is now being promoted by the European Commission as a means of reducing low pay and promoting equality. Median hourly pay, excluding overtime, for full-time care workers, and this would be interesting, you obviously would be very aware of this, Mike. Median hourly pay, excluding overtime, for full-time care workers in the UK was £11.95 in April 2023, compared with an average of £17.40 for all employees. And this means care workers are among the 20% of employees with the lowest pay. The majority of social care staff are employed by private sector providers who are responsible for setting their pay and conditions. However, most providers accept clients whose fees are, at least in part, paid by the local authority. And as a result, public funding has been described as integral to social care provision and pivotal to wage setting. So once again, capitalist gain and socialist risk. Social care is funded by the state, or a large part of it is funded by the state, but the private providers, of course, make the profit. Clause 29 would give the Secretary of State the power to make regulations establishing an adult social care negotiating body. The body would be required to include members from trade unions and representatives of the adult social care employers. Clause provides for the regulations to be able to amend existing legislation in consequence of the establishment of the negotiating body. The negotiating body's remit would include the remuneration and other terms and conditions of employment of social care workers or social care workers of a specified description. Other matters related to employment as a social care worker would also be able to be added to the body's remit. Clauses 32 to 40 provide for the Secretary of State to have the power to make regulations making further provision relating to the negotiating body. This would include powers, among other things, to specify factors that the negotiating body would have to consider when coming to an agreement, and refer an agreement back to the negotiating body for reconsideration. So in actual fact, the Secretary of State has tremendous power again. Have the power to control this body. So once again, it all goes back to the Crown, the representative being the Secretary of State. So I've just taken a few bits out of the bill there, and it would be really good to hear what people think about that. Yes, Tim.
Right. No, I think, Carol, in fairness, if you were to read 20 or 30 other bills in detail, the way you've done here, which would be a pretty challenging task,
Yes.
You'd probably find that all of them contain multiple clauses giving all sorts of sweeping powers to the relevant Secretary of State. So there's probably nothing unusual about these points that you've highlighted. That's all.
Okay, thanks, Tim. Would anybody else like to have a word? Steve?
Well, what Tim says is obviously true, and you'd find the same thing. All the bills you could see would all begin with those rather strange wordings that you commented on at the beginning of the legislation. And although we look at it in this 21st century and think, well, what a joke, but the fact is that describes the actual process by which our constitution works and what has to be done in all that language for anything to become a law. So it is the constitution, laughably, if you like, put before us in every law that we get. And Tim's quite right, that this would be pretty general. But the thing that struck me, Carol, from what you said was trying to work out what any of this means. Can you imagine anybody but a lawyer being able to work out what the hell was going on? I mean, if you wanted rights for workers, you'd think, well, workers could read it and understand what it all meant. But nobody, we or anybody else can hardly make head and tail out of it, and we're not meant to. It reminded me of, I think, Marx's description of the French Constitution back in something like 1848. He said, you've got these fantastic rights in the French Constitution, but every right has got a clause whereby their get-out clauses, like the way you said. In other words, it really amounts to nothing, because everything you think you got, you haven't really got at all. And it's just open to the balance of forces whether you get it. Now, that's not to say there isn't something in there that would be useful, but really the point is you need to be in a trade union. And I think, I mean, I'd love to hear I also like to hear what John Hendy had to say about it as well. I'd be interested to see that, but I quite agree with your analysis and more of it. But Tim's point, I think, is also true. All laws are written like that. They're not written by ordinary people. They're not written for ordinary people. We're not meant to be able to understand it. We're meant to be able to phone up a lawyer and get some interpretation of it. So it's not really giving rights at all, you know. I don't think, you know. Anyway, that's my little.
That was, and I was using a document in order to prepare that. I was using a document which was supposedly made it much easier. I didn't actually go to the bill itself because I just looked at the first page and I thought, oh my goodness, I'm going to need about 3 or 4 bills, you know, around me before I can work out what the actual change is, because it refers back to the 1996 employment bill and the 2023 and the 2024. I mean, if you go through that document, it keeps referring back as a preamble to each change. There's a whole preamble, so it's a very, very onerous task to make any sense. And that was the easy one. That was the easy document.
Can I just make a comment before you go on to Peter, Carol, on what you said? We read that very interesting book as the Republican Labour Education Forum by Ian Dunt, showing how MPs had no idea what the hell, although we think our MPs are our legislators, by and large, they've got no idea of what is going on. They're just told to which way to vote because everything is done exactly in this style. It's designed to exclude democracy from having any say in making law in exactly the way, and it's there in the bill. Ian Dunt says you'd have to have about 10. I mean, if you went to the European Parliament, apparently, the way they just do it slightly more simply, in the European Parliament, you'd get a bill presented, and then you'd get a little clause saying, remove that line above and put in this. And you could see at a glance what the hell was going on. But the way it's done in the House of Commons, you can't really, lots of different documents. It's not designed to.
So I'm gonna go to Peter now. Peter, over to you.
Yeah, thanks, Carol. Trying to make some sense out of this legislation. And you're quite right what you're saying about the wording of it. And Steve's right, you know, it is designed to make it totally understandable for normal people. I remember when I first started on the railway, the Health and Safety at Work Act came into being in 1974, and that everyone said what a marvellous thing this was. It was a Labour government that brought that in. What a marvellous thing this was, and it's going to enable the trade unions to attack the employers and improve safety at work. But the way it was actually worded was that the biggest clause in the bill was this wonderful word of reasonably practical, and everything was subject to this reasonably practical test. And of course, for the employers, nothing was reasonable in if you asked for improvements in health and safety. That it always came down to this reasonably practical, and that was how they got around it. And it's similar to this what you've read out about the Secretary of State having all these overriding powers so that they can dismiss any action from employers. And this, you know, I can understand why Sharon Graham has started jumping up and down, because obviously she's seen that this is a nonsense, and it's not what they were all signed up to. And I think the consequences could be very serious for the Labour Party if the Unite actually does start to campaign against this legislation, because you know, if it's got more holes than the Swiss cheese, it's not worth having, and they need to fill those holes. And it shows the lobbying that went on before the actual election from the employers, and the Starmeroids were denying it, saying that, you know, no, it's nothing, you know, nothing to see here, Governor. It's all kosher. Well, it bloody well wasn't, because as you say, the clauses there give the Secretary of State overriding powers and allow the employers to basically do what they want. Because there's, you know, if you try and attack an employer for doing, you know, for sacking people or whatever they're doing, they've got all these get-outs. I've never seen a piece of legislation like it. It is actually appalling. And to be honest, we need to start getting the unions to get off their backsides and start campaigning against it, and to improve it, to claw back all this stuff that's been thrown out. Anyway, thanks, Carol, for that.
Yeah, I think you're absolutely right. And a lot of it will rely on good old secondary legislation, as usual. that old chestnut, you know. So just that I think was it Suella or Cruella, as we've renamed her, brought that in for some of their protest laws that they were passing. So we got the joy of secondary legislation as well. Mike.
Yeah, just thanks, Carol, for picking your way through this absolute. Well, it's not so much a minefield as you know, as a sort of maze of obscurity, in which the ordinary person, as Steve says, is designed to get lost. It's what it's all about, really. So, you know, thereby concentrating the power. Just on Sharon Graham, Peter, I mean, there's something else going on there, which is covering her back. I mean, you know, I'm in Unite. I voted, as did most of my comrades in my branch, voted for Sharon Graham as the best and possible, but you know, better than the others, and possibly a more independent spirit. Well, what we got was a social chauvinist, somebody who really, you know, on matters like this will saber rattle and manage to look very militant, as she did again around the question of the winter payments for pensioners. And she, you know, made it sound really tough. But this is a distraction from the fact that actually she is preventing, you know, members of her union from doing anything practical with regard to Palestine, either talking to those members who work within the defense industries, which is what we want to do, and you know, building resistance to the export of you know, all the arms related stuff. Sharon Graham has really resisted that and has disciplined people within the union for doing that. Well, she wants to preserve her left-looking face, so this is the way she does it. So, you know, things aren't quite quite as they seem. I think with regard to, you know, the bill itself, though, there is, you know, one of the other clauses that struck me was employers should do this so long as it doesn't impinge upon, you know, their finances. Well, this in planning law, this which is stuff introduced by the coalition government under Cameron, and Eric Pickles in particular put this through, what's called the viability clause. So in new developments of housing, you know, there was a stipulation to have a certain proportion of social housing and certain, you know, to invest in infrastructure, unless it affected the viability of the development. And guess what? Every bloody housing development has had this viability clause invoked. Oh, well, we can't afford to have social housing or affordable housing. And so we end up with a series of commuter rabbit hutches that, you know, currently are sprouting everywhere and not the kind of housing that many local people actually need. I think, yeah, the Secretary of State is obviously, you know, going to be influenced, as we have seen, by who lobbies hardest, and that's already a done deal. We saw in the run-up to the election the employers lobbying really hard. You know, various corporations, various industry bodies providing lots of goodies, not only free suits and Taylor Swift tickets, but logistics support for MPs, and actually parachuting in. Quite a few of the new Labour MPs themselves worked, you know, a local MP to me, the MP for Ipswich, was actually, you know, worked as a paid lobbyist before he got elected, and he's not the only one. There are a number of these people. So already we see which side, you know, it is not a relationship between equals, and nothing has been done in this legislation to rectify that balance. It is, you know, it is just merely camouflaged some of the unfairnesses and inequalities while retaining absolute power. I mean, the Secretary of State ain't going to be reforming if he or she ever considered it. Look at the example of the Transport Secretary, who did dare speak out against P&O and actually said to people that she thought they were shysters and criminals and they should be boycotted. Well, she was shut up pretty quick and sidelined by Keir Starmer. And you know, that's the way it's going to be.
Yeah, that particular example, the P&O, was horrendous. It was heartbreaking, the stories that we heard from the union representative about people who their whole security, you know, their future, they planned with this salary that they were going to be given, and just taken away in a flash, and for no good reason, just to employ people who be paid less than the minimum wage. Just appalling employment practice. Right, so I don't see any. Oh yes, John, over to you.
It's a timely meeting, this, and timely legislation. I have a fine example in my hometown here in Wrexham. We have an ongoing a strike action by local employees. 800 local employees have been given are facing fire and rehire, and the company are refusing to even talk to the Welsh government about it. So us in Unite are set for a long dispute, and it's all down to the local employees. They're not going to get any protection from the legislation as it stands, or I think, and I don't have much hope that the new legislation will help them either. But it just shows you what we're up against.
Sorry, I had muted myself there. Sorry. Yeah, absolutely, John. Something else that I didn't mention while I was talking about the various sections, that the statutory sick pay going from day one instead of from day 4. I can see unscrupulous employers saying, oh, well, since you've got statutory sick pay from day 1, then we don't have to supply any. And so people will be literally on that ridiculously low amount per week, which I think was £116.75. And their employer, I'm sure, unscrupulous employers will take that as a chance to not provide sick pay to not keep their employees on their normal salary for the first 3 days. They'll go right down to the statutory sick pay and deduct those 3 days pay from their salary at the end of the month or at the end of the week. I can see that happening. So what it's actually doing, in a way, it's shifting responsibility for sick pay from the employer to the state. If you look at it from that point of view, I don't know if others agree with that. Peter?
Yeah, I was just going to comment on this P&O dispute that took place, because one of the things that nasty, well, I could think of some nasty words to say about him, but the bar stool that runs the company actually said in a select committee meeting in the House of Commons to the MPs that yes, he knows that they broke the law, and he basically said, what are you going to do about it? And up yours. That's basically what he did, and then walked out. And that was that. He put the challenge to them because he knew damn well they hadn't got any power to do anything about it. And the problem with a lot of this is also the Secretary of State might not be a Labour Secretary of State. It's going to, you know, as time goes on, it will be a Tory Secretary of State. And they're going to abuse this to no end. I mean, you know, we think our employment rights are bad at the moment, but they're going to be a lot worse if this legislation goes through and the wrong Secretary of State gets put in place, because they won't even have to bring it to Parliament. They can just sign it off. And if you notice all through all of this, when they read this out in the Commons, there was no major opposition to it. The employers, the BBC and everybody were scuffling around trying to find an employer that would say they didn't like it. They couldn't find them because they were all quite happy. And that is very, very worrying if the employers themselves are happy with the legislation. We should be very unhappy about it.
Absolutely. I totally agree with you. Absolutely. Mike?
Yeah, Peter's absolutely right about that. And just tying that in with what you were saying, Carol, about statutory sick pay. Well, indeed, you know, this follows a pattern in contemporary capitalism, not just in Britain, but internationally, of greater and greater reliance upon the state as their enforcer. Because actually, you know, it's the so-called neoliberal model enables them to be able to sort of have massive pickings with the state subsidizing them. You know, we got the example of low wages being subsidized by universal credit. And, you know, all the time, you know, outsource and privatization within the NHS, for instance, is very much a cherry pick of those services from which the private providers think they can make some money. And in clinical terms, you know, they do simple stuff, not very well, and sometimes it goes wrong. As soon as it goes wrong, guess what? The patient is shuffled back double quick time into the NHS hospital to pick up the pieces. And the very worst that can happen is that the contract for that private provider to do that particular clinical piece of work is not renewed. But, you know, very often the terms are so weak that they're allowed to get away with it in perpetuity. So I just wondered, Carol, whether we should sort of move
Yes,
from this into the
that's exactly what I'm
Ipswich and
going to suggest.
Colchester
Yes,
Hospital,
because
because we do have a Secretary of State there
yeah,
who has said, Wes Streeting, who's said very clearly that he's in favour of more privatisation and it will somehow help the NHS.
absolutely.
So
So I'm going to.
should we move into
Yeah.
that?
Absolutely. I'm going to hand, this was the second main item on the agenda, was Mike Hope talking about the outsourcing of soft services by Ipswich and Colchester Hospital Trust. So I'm going to switch over to Mike to address the meeting on that topic.
I won't talk for long, actually, and I will also call on Tim, who's in the Colchester area and has numerous contacts, both on the left and within hospital workforce, to sort of provide further evidence. But yes, soft services. It sounds so cuddly, doesn't it? But actually, soft services mean everything which is not clinical. So it's porters and cleaners and caterers and housekeepers and support staff. And guess what? These are all the people who are the lowest paid anyway within the whole NHS hierarchy. But, you know, they have struggled to get, you know, marginally better, halfway decent terms and conditions working within the NHS. And it's been a real struggle. And coincidentally, people like Jeremy Corbyn and his great mate, Bernie Grant MP. Do people remember Bernie Grant, the first black MP? Before they became MPs, they were full-timers for the constituent of what is now Unison, that was known as NUPE, the National Union of Public Employees, who, you know, represented primarily these groups of people. And they really fought hard to get the sort of terms and conditions that were, you know, at least sort of enabling these workers to have some kind of a life. Well, hospitals have over time quite frequently outsourced. Cleaning is a particular example. They've been outsourced for quite a long time in many cases, with horrendous results in terms of you know, the actual cleanliness and the spread of infection. So in many cases, they've had to be reabsorbed back into the NHS. This is what you know, the outsourcing means. It means cutting corners. It means employers making, you know, being able to make their profits by paying people less and getting them to do more, but with fewer staff. So invariably, the conditions actually, you know, provided are less good. So it's a hide into nothing, but this hasn't stopped employers periodically trying it. Well, the latest one is what's referred to locally as ESNEFT, which is the East Suffolk and North East Essex Foundation Trust. which comprises two big hospitals, Colchester in northeast Essex and Ipswich in Suffolk, and also a minor community hospital, Aldeburgh Community Hospital, out on the coast. Now, Colchester has never, all their staff have been hitherto employed by the NHS, all their, soft services staff, the groups of workers I spoke about, they've been employed by the NHS. Ipswich, on the other hand, managed to privatise them some time ago. And the same is true in Aldeburgh. But they now have one joint CEO, which is a gentleman you might all have seen on BBC News because he's the media's favourite hospital trust CEO for, a talking head comment, a guy called Nick Hume, who seems very amiable and smooth when you see him on the box, but actually is he has a reputation as a complete bully and a bruiser. And he has decided that, it's time Colchester came in line. So what has happened actually is this dispute obviously drew resistance from all the portering and cleaning and catering staff in Colchester, as they saw what was going to happen. But it has also united them with the Ipswich staff who said, we want to come back in-house. We have lived under these conditions. We're getting less pay. We're getting shorter holidays. Our terms of sick pay are not as good. We have a bullying employer and we are being told to cut corners, and we know it's not good. So this whole campaign is actually for better terms and conditions, yes, but actually for better conditions for patients and for, for clinical staff as well. So they have massive support from clinical staff. It's been, Nick Hume has sort of boasted that the decision has already been taken. Formally speaking, it hasn't. But the local clinic, the local integrated care board claims never to have discussed it. And the key meeting is one in November, where, I think Nick Hume hoped it would just rubber stamp the decision which he believed had already been taken. But this has now moved from being a parochial dispute to being a national, symbol of the fight against privatization and outsourcing in public services, particularly, under the beginnings of a Labour government, where standards should be required to rise as part of the rebuilding of the NHS, which is, as we know, is virtually broken. So there have been lively pickets at each of the sites. On Saturday, there was a demonstration involving all of them in Colchester. Despite rain, about 300 people turned out. It was an incredibly vibrant demonstration. And, as I say, I think at national level, Unison and Unite and GMB are putting a lot of effort into this. So I think there's certainly nobody's at any stage looking to cave in or give in. So I think watch this space. It could become bigger and could become, really a symbol for the whole country of this struggle. But Tim, I wondered from your contacts whether you were able to... Oh, one more thing before I do that, by the way. This isn't a small issue, really. It does involve 1,200 staff in total. and it involves a contract that is worth £100 million. So, you know, it is really quite large. And the CEO, Nick Hume, has already brought in strike breakers, has already brought in scab labour at, at certain times when people have been taking industrial action. But Tim, tell
Yeah.
us how you see it from your perspective in Colchester.
Okay. Well, I've jotted down a couple of things. First of all, it's not strictly true that Colchester has never been outsourced. One service, an important service, cleaning, was outsourced several years ago. It seemed like a good idea. That was before the hospital came under Nick Hume. That was under a previous manager. So it was outsourced, and then promptly within 2 or 3 months, there was an outbreak of MRSA, and it took years to get rid of this MRSA. And the only way they realized that they could get rid of it was to bring the service back so that the cleaners would use the proper cleaning materials, would clean with the frequency required to stamp out MRSA, which they eventually did. Okay, that was the first point. The other one you mentioned, Mike, about Nick Hume, the CEO, being a bully. Well, just as an example of his performance, when we had the COVID outbreak in, well, it was officially announced in March 2020, there's staff in the hospital, as in most hospitals throughout the country, they were going down like flies with sickness, and in many cases dying, yeah, because there were no vaccines in those days. It was Nick Hume who ordered that no hospital staff were to wear face masks. They couldn't even bring in their own. No face masks would be provided, and staff wouldn't be allowed to wear face masks of their own. It was absolutely crazy. This at a time when other countries like Italy were all imposing face masks on their staff. So that is the kind of bully that Nick Hume is. And I've got a friend who's a phlebotomist, and she took early retirement because she was ordered not to wear a face mask when taking blood from patients. And of course, that is something where the phlebotomist has to be very up close and personal with dozens, maybe 50 or 60 patients who come in per day from outside, and 1 or 2 of them could be carrying COVID. Right, that's enough of that, I think. Now, the other thing is, the dispute is, of course, continuing, as you rightly say, Mike. They've been on strike today. They're on strike again tomorrow. Then they'll see how things go, and then doubtless we shall have more strike days being announced in days or weeks to come. Yeah, that's all I've got to say for the moment, but there we go.
Thanks very much, Tim. Some really on reporting, from the actual situation. It goes much wider than just, Colchester, Ipswich and Colchester Hospital Trust. This is going on, throughout the NHS with these dreadful integrated care systems, 42 of them, which of course are easily saleable off to private, American healthcare companies. You've got United Health, which is an American healthcare company, on most of the boards already. So it's a really frightening situation, and it's not just in Sussex; it's all over the country. Mike.
Yeah, Suffolk, not Sussex, by the way.
Sorry. Suffolk, I'm terribly sorry. Suffolk.
Yeah, I mean, integrated care boards. I mean, it's interesting. Certainly board for here has held its hands up and said it's nothing to do with us, which is just, you know, either a degree of incompetence which is breathtaking, or they're frankly sort of lying and hoping that they will get away with it. Clearly, you know, the running of the hospital trust under the legislation which brought in integrated care, so-called integrated care, the running of hospital trusts is, you know, that they have to account to their local integrated care board. Likewise, we actually approached, this is colleagues in Unite, we're setting up a Keep Our NHS Public campaign locally, and we approached the local Health Watch. Health Watch is the sort of toothless watchdog that was set up under Andrew Lansley's Health and Social Care Act, supposedly to be the voice of the patient. And Health Watch, who conduct investigations into patient experience of a whole range of clinical, hospital and community-based services, Health Watch said they hadn't had conducted any consultation about this, neither did they intend to. And I currently have a colleague who's having an elongated spat with them about how they can talk such nonsense and try and fob him off when he is a patient, a member of the public, and it concerns him and that concerns many others. So we will see where that leads. But integrated care boards, of course, they changed the name. It wasn't originally integrated, it was accountable. This was the American insurance model. They're called accountable care systems, but this is not accountable to you and me or the patients or the public. Oh no, accountable to the balance sheet. This is, you know, accountable to accountants. It's all about the money. And at the, you know, the bottom line with, you know, ICB's integrated care boards is that they have one budget and they stick to it. There is no more money. And it's a way for the Secretary of State for Health to say, nothing to do with me. It's completely disingenuous. And of course, you know, brought in by the Tories, not opposed by Labour, and now Labour's in power. They don't really want to do anything about it. Just one final example, because the NHS has, you know, flirted with attempts at privatisation for a long time. And in one case, just up the road, not that far, a hospital called Hinchingbrookes Hospital in Huntingdon, just after the days of John Major, but very much representing John Majorism, I suspect. The Hinchingbrookes Hospital was outsourced in total. All services, including clinical services, were outsourced to a firm which has been subsequently, you know, bought and acquired by other firms, but it was called Circle. Circle ran Hinchingbrookes Hospital for about 2.5 years. Everything plummeted. Patient outcomes nosedived. Staff morale nosedived. The only thing which didn't was, you know, as Tim said with to MRSA, cross-infection rose steeply. In the end, Circle were forced to hand back the contract. They said if they did half the things that were required of them to rectify the problems that were identified, they wouldn't make any money. And lo and behold, that is the story of privatization and outsourcing in this area. If they, you know, if they were to meet even the half-assed requirements that are leveled at them, they can't make profits. So they will always and invariably and by their nature cut corners. So indeed, this is a struggle which is as much on behalf of patients and local people as it is on behalf of the local workforce.
Extremely worrying. I mean, I know I'm sure most of us here have been listening to Dr. Bob Gill. He was at our day school in November last year. Sorry. He's obviously on very often on the Crispin Flintoff show. And this is so, the future is looking bleak. And I know this is only a television program, but if you want to see what American healthcare is like, watch The Resident on Netflix. It's a very good series, and it highlights everything that is wrong with the American healthcare system. And that's where we're heading in the UK. We'll have a two-tier system. We'll have the people who can afford health insurance will be going to private hospitals, and then the rest of us will be going to state hospitals. But as Mike pointed out, the minute there's anything seriously wrong with a patient, or something goes seriously wrong with an operation, they immediately send them back to the NHS, where they can be dealt with properly, where they have the proper facilities to deal with resuscitation, etc., etc. So the future for the NHS is looking so bleak at the moment. And I just hope, Mike, that you and Tim and the other people that are involved can keep on fighting at least this one battle with this hospital trust to stop the outsourcing of even soft services, because in other places they're bringing clinical services. Clinical services are being provided by private providers, with all the risks that you've actually outlined, with all the risks that involves. So, Mike, over to you again.
Just a postscript. I mentioned that in this case, the unions involved are primarily Unison, but with support from Unite and GMB. So it and even the RCN, where there has been quite a lot of hostility typically between Unison and the RCN in many hospitals in the past, but there's common cause even there. However, these TUC-based unions do have they have their feet, certainly Unison, and I was making critical comments about my own union, Unite, earlier. They have their feet in compromise, and they have already sort of done deals. Some of the best battles against outsourcing and to bring groups of workers like security guards back, working for the British Museum, I think, back into direct employment, back into public service rather than outsourced arrangements, has been conducted by the so-called pop-up unions, UVW, the IWGB, Independent Workers of Great Britain. These are not TUC affiliated. They are member-led. They represent typically the most marginalized workers. They represent cycle couriers and so on. Even yoga teachers and sex workers are represented by these unions. But they really work hard with their members. They let their members have their voice, and they tend to win. Many of these local outsourcing battles have been won by unions like that. They take some very direct action. We need to learn from them.
Thank you very much. Tim.
Yeah, just briefly, you mentioned the threat that clinical services may be outsourced. Well, quite a few of those already have been outsourced. I'm thinking, for example, of certain things that I've had to have dealings with myself, such as audiology. I wanted to get a hearing aid or a pair of hearing aids. When my wife got hearing aids about 5 years ago, she simply went to the audiology department of Colchester Hospital, and they provided a pair of hearing aids for her. Well, I decided, or my wife decided, that my hearing was getting so bad that it was time for me to follow suit. And of course, I go there and fill in a form. they write me a letter saying, go to Specsavers where they will test your hearing. And of course, Specsavers take advantage of this to try to sell you some expensive private pair of hearing aids. So fortunately, in my case, they said, well, there's an imbalance in the hearing between your left ear and your right ear of greater than 20%, which is in fact true. And therefore, we're sending you back to the audiology department. So I was rescued, but quite a lot of other people will be left with nothing but Specsavers for their hearing aids.
Absolutely.
And there are other examples as well, but I won't bore you with all the details. Yeah.
Absolutely. Also, having your ears syringed. You can't have that.
Oh, forget that.
That you'll
Fee
have
of £80.
Yes, I believe so. Yes, over £80 to have that done.
Yeah.
It's a shocking, it's a fright, as I say, it's a frightening future, and I don't think people in this country realize what we're headed into. We're losing our NHS, and people are sleepwalking into it. So thank you, Tim and Mike, for what you're doing, and I really hope that you can make a difference with your hospital trust, because what you're doing is so important. Thank you very much for attending, and thanks to Mike for bringing that item, and enjoy the rest of your evening.